Today's show is all about the heart. Next on Sinai-Grace Today. Hello, I'm Melanie Moss. Did you know that poor dental hygiene is linked to heart disease and that erectile dysfunction is an early indicator of heart disease? Did you know that too many people wait too long to go to the hospital when they're having life-threatening heart attack symptoms? On February 27th at 9:30 a.m. in the Sinai-Grace Auditorium, join our heart experts during the People's Medical College and learn the dangers of self-diagnosis and the less commonly known risk factors associated with heart disease. The kickoff of Healthy Hearts, Sinai-Grace's Heart Failure Support Group, will commence on Thursday, February the 18th at 2 p.m. This monthly group is designed to educate patients, family members, and caregivers on how to manage and control heart failure. It is open to those who are at risk for heart failure and those with other forms of heart disease. The meeting will be held at Sinai-Grace in room S388 every third Thursday at 2 p.m. February is Healthy Heart Month. Let's find out what we can do to keep our hearts healthy. Catherine?
Thanks, Melanie. As you just heard, it's Healthy Heart Month in February, and I'm here with Chief of Cardiology, Makaram Siddiqui, who's going to tell us some tips for keeping our hearts healthy. Dr. Siddiqui, who's at risk for heart disease?
Men above 40 and women above age 50. People who have high blood pressure, diabetes, high cholesterol, those who smoke are at high risk for development of heart disease. People who have body weight that is more than what it should be tend to develop accelerated atherosclerosis and needs to be aggressively treated and managed in that regard.
And who's most at risk for heart disease? Is it men or women?
Depends. In men, it has earlier onset, and women, once you attain the postmenopausal stage, the risk is equal to men. In fact, maybe slightly higher. So aggressively screening and aggressive treatment is very helpful.
Dr. Siddiqui, what are some things we can do to keep our hearts healthy?
Identifying and treating the risk factors, which include treatment and management of high blood pressure, aggressive screening and management of diabetes and high cholesterol, will go a long way in reducing the risk. If you have high cholesterol, know your numbers, get treated for it, and you need to exercise regularly and change your dietary habits. You need to increase the fruit intake, you need to increase the vegetable intake. That'll help a great deal in reducing your cardiovascular risk.
What's your favorite form of exercise?
I exercise regularly on a treadmill, 20 to 30 minutes every day, and I exercise outside in spring and summertime.
Great, thank you. It's Healthy Heart Month in February, and we should all be doing more to keep our hearts healthy with regular exercise and a diet filled with fruits and vegetables. I'm Catherine Higgins for Sinai-Grace Today. As employees at Sinai-Grace, many of us have daily interactions with patients and their families, but sometimes we get to view things from the other side when we're the patient or a loved one is in need of medical care. Recently, one of our employees had just such an experience. Here's her story.
Well, most people know me. I'm Joan Valentine. I'm the Director of Clinical Resource Management. And recently I had a family member who was not feeling well and required the services of Sinai-Grace. He came through the emergency department and got very good care, excellent clinical workup, and the decision was made that he needed to go to the cath lab. And it's very frightening when your life is sort of changing right in front of you. And the cath lab staff truly picked up on the support that I needed and gave me the confidence that even though he was out of my sight, they were going to take very good care of him. And afterwards, explaining to both myself and my children everything that was going on and things that we should look forward to in the future, he then went to 3 West, where he got absolutely excellent nursing care. And he was discharged. He's doing well. He now has a Sinai-Grace cardiologist, which I'm very happy about. And the care that he has received has been excellent. And I would not have one doubt in my mind that I shouldn't recommend Sinai-Grace to any family or friends who ask for services.
Find out what kind of love Sinai-Grace employees are handing out to their patients on next week's Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.